Health authorities in Nigeria say 40 people have so far died from a recent outbreak of Lassa fever in parts of the country. At least 86 cases of the disease have been reported in 10 of Nigeria's 36 states. CCTV's Deji Bedmus has more.
The current outbreak of Lassa fever occurred late last year in about 2 northern states, and within weeks it spread. 10 states are now confirmed to be affected, both in the north and south of the country, and 40 persons have so far died from the disease. Authorities put the mortality rate at 45%. Now, the speed at which the disease has been spreading has alarmed health officials. Nigeria's Minister of Health has now called a press conference in Abuja where he gave every assurance that the government is doing everything to contain the spread of the disease and urging people not to panic.
In response to these reported outbreaks, the Federal Ministry of Health under my leadership has taken the following measures to curtail further spread and reduce mortality among those affected. 1. Immediate release of adequate quantities of ribavirin, the specific antiviral drug for Lassa fever, to all the affected states for prompt and adequate treatment of cases. Deployment of rapid response teams from the ministry to all the affected states to assist in investigation and verifying the cases, as well as tracing all contacts. Clinicians and relevant healthcare workers have been sensitized and mobilized in areas of patient management and care in the affected states. Affected states have been advised to intensify awareness creation on the symptoms and signs, including preventive measures such as general hygiene. Furthermore, it is important to note that Nigeria has the capability to diagnose Lassa fever. All the cases reported so far were confirmed by our laboratories. However, due to the non-specific nature of Lassa fever symptoms and varied presentations, clinical diagnosis is often difficult and delayed, especially in the early course of the disease outbreak.
Now, states across the country are carrying out enlightenment campaigns asking people to maintain proper hygiene and keep rats away from their environment. Health experts say Lassa fever is caused by infection with the Lassa virus, which is spread by rats that live in large numbers in West, Central, and East Africa. In most cases, the symptoms are similar to those of the Ebola virus and has an incubation period of 6 to 21 days. But the good news is that there are antiviral drugs to treat this disease. Deji Badmo, CCTV, Lagos, Nigeria.